Morning, workers at nursing homes and long-term care facilities across the country are really sounding the alarm over new federal staffing requirements, saying they will be impossible to meet. The American Healthcare Association and several other groups in Texas suing the Biden administration, which responded to the lawsuit saying the new standards will improve safety and care of the patients. Well, Stephanie Haynes is joining us now live from Dallas to explain. And Stephanie, long-term care facilities say they already face staffing shortages, and new rules could only make the problem worse. But we got to look out for our elders. Tough spot to be in.
Yeah, definitely, Anna, and good morning. You know, the CEOs of multiple long-term care groups say that these new rules could really force some of these nursing homes to close and then force a lot of elderly patients to have to move and thus diminish the quality of care. So this is all, they say, counterproductive to the Biden administration's goal. And so in the lawsuit, they lay out, specifically which couple of rules that they take issue to. The first being providing each resident with at least 3.5 hours of care per day. And the second, have a registered nurse on site for 24 hours a day, 7 days a week. So according to a White House fact sheet, that means if you have 100 residents, you're going to need at least 2 RNs, 10 nurse aides, and 2 more nurse staff per shift. And if you fail to meet those standards, you could risk losing your Medicaid and Medicare funding. So in the lawsuit, the group's suing, write, quote, "It simply makes no sense to impose a blanket 24/7 RN requirement and rigid staffing ratios on thousands and thousands of nursing homes across the country, regardless of each particular facility's local conditions and unique circumstances." So in response, the U.S. Department of Health and Human Services writes, quote, "The status quo in too many nursing homes unacceptably endangers residents and drives workers into other professions. The Biden-Harris administration is committed to fulfilling the president's promise to improve safety and support workers so everyone can age with dignity." And they say that they made these rules after considering close to 50,000 public comments shared from families who, share horror story after horror story of their elderly loved ones in facilities not getting the care they need because there wasn't enough staff. And they add that there are more than 1 million patients nationwide who get care from nursing homes that are Medicare and Medicaid funded. However, the American Healthcare Association, who is suing the Biden administration over this, says these new staffing requirements are going to cost facilities as much as $6.5 billion a year if they have to staff up just like this. Anna.
All right. Thank you so much for that, Stephanie. Got to look out for our grandparents and great-grandparents.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.